Welcome back. Today, many families and college students are setting off for spring break trips and travel. But a concern around the country and here at home is the current spread of measles.
Yeah, state health officials have reported 8 cases since last month alone. Here to talk with us about whether these concerns are worth worrying about is MSU Denver biology professor Dr. David Merriam. Thank you for being here. I hate that we have to discuss this, right? But I'm glad that you're here to provide additional details.
A lot of the cases we're seeing are coming from Broomfield.
Right.
And what do we need to know? I feel like we've been saying this since 2020, but what do we need to know about vaccinated versus unvaccinated when it comes to the measles?
Yeah, when it comes to measles, the MMR vaccine is one of the best vaccines that we have. Just flat out one of the best.
And we know that because we've seen it work, right?
We've seen it well. If you look at cases right now, well, for one, near eradicated, yeah. But if you look right now at the number of cases that are happening right now, nationwide, you're looking at about 92% of all of the cases are in people who aren't vaccinated. And when 88% of the population is vaccinated, that means a very small sliver of the population is actually getting the bulk of the shares of these measles cases. That really speaks to the testament of just how potent this vaccine can be.
Right. And what are some things that families can do to protect themselves while they travel or even just, out and about here in Colorado?
Well, I think one of the best things to keep in mind is that if you are vaccinated, the risk is going to be very low for you. And that's not something you're going to need to overly concern yourself with. If you are choosing to be unvaccinated, or if you have a reason why you can't be vaccinated, because there is a population who cannot be, one of the best things you can do is keep an eye at public health agencies. They do a lot of great reporting. Our Colorado's department has a great database where they report every time there's been an exposure, and they'll say, if you were here over this period of time, you might want to get that looked at. And there are options for after exposure getting that vaccine, and that can actually protect you at that point too.
For our viewers who aren't familiar, how does it spread, first off, and what kind of lasting damage can it cause?
So it spreads via respiratory droplets, kind of very much like COVID, a little different, but sneezing, coughing, breathing. People who are asymptomatic can spread it. So people who, if you haven't started to get those rashes, you may already be spreading the measles.
So it does act very much like COVID.
Yeah, absolutely. And then as far as lasting damage, there can be cases of things like encephalitis, swelling of the brain. You can also have cases, and it's one of the scary things about measles for me, is it does this thing called immune amnesia, where if you had a previous disease, you're a little bit protected from that just by having had that disease. You have these cells in your body that are protecting you. And what measles does is it targets your immune system and kills those cells. So if you had COVID, hooray, you're going to be a little bit protected from having COVID. Then you get measles, you're no longer protected from COVID.
Really?
And it does that across the board?
Across the board.
It goes for all those kinds of cells?
Yeah,
Okay.
yeah.
Wow.
Could be COVID, could be flu.
That's
terrifying. Could be common cold, everything.
Before we let you go, just to our viewers, and no judgment. I know you said, a lot of people out there physically can't get the vaccine.
Sure.
To those that are just hesitant because of said misinformation, what would you want to say to them?
Well, I'd want to say the same thing I always want to say, which is every therapy is not without its risks, but if you compare the risk versus the absolute benefit that you're getting, it should probably be a no-brainer.
Okay.
It's amazing we're talking about this. We sat down with you and said, I can't believe we're talking about this, because for years it was gone.
Yeah.
And I mean, that's true with most diseases. We've really only eradicated smallpox. So there are other diseases out there that we have knocked down to a very low level. But
you got to keep fighting the good fight.
Yeah, you have to keep fighting the good fight.
And it takes all of us. Herd immunity.
Absolutely, 100%, yeah.
Okay, Dr. Merriam, thank you. We appreciate you.